Hello, good morning, everybody. How are you today? Thanks so much for joining me. Today is our second Wellness Out of the Box interview series, and I am just so excited. So, you guys, first and foremost, thanks for joining me. Many of you guys know me. I'm Kelly Lupsha. You can follow me at Kelly Lupsha. You can follow me at The Lupshas. And my passion is to truly teach people to become the CEO of their own health, of their own wellness, of their own life. And the hard thing for all of us is sifting and sorting through so much that's out there, right? With the internet, with technology of today, we can get our hands on so much information. But at the same time, sometimes we're like, what is this information? Is it legit? Is this for me? How does it work? How do I get more education? And so my job is to help provide education. I'm going to find experts in the field. They're going to bring you education on a variety of topics that if you went into your traditional, medical practitioner's office, they might not have answers for you. Or maybe they just don't know where to direct you. We're all very focused in our field. If you don't know my background, I'm a physical therapist by background. I have my own private practice with my husband, OC Neuro Rehab in Southern California. I absolutely love what we do in helping people recover from stroke, traumatic brain injuries, concussions, other neurological issues, and really promoting wellness at a cellular level to them. At the same time integrating, right, traditionally what we do as physical therapists, but also optimizing their brain health at a cellular level. So it's so exciting. But what I find even more exciting is that there are hundreds of modalities out there in the world that you or your family or a loved one may benefit from. So many of you may have seen last week. If you didn't see last week, I would encourage you guys to go back in the feed, either here on my page at Kelly Lupsha or at The Lupshas. And you can see I had Dr. Ruth McCarty on, and she was speaking on acupuncture. She's a doctor of Chinese medicine. Sorry about my fingers in the way, you guys. I am just bringing on our next guest here. And it doesn't like my finger touching. And she was speaking on specifically acupuncture, but on so many other ways as a doctor of Chinese medicine. So I am going to bring our next guest on. Give me just a moment. And I am going to be adding this incredible gentleman. And you guys, let me tell you, you are absolutely in for a treat. So Dr. Alexander Thermos, you're going to be seeing something either flashing saying, yes, add me, or connect, or I accept. And all you have to do is hit that button and you are going to come on with me. So see if you can find that little magic button. But as you guys, I was telling you, is I'm just passionate to make sure the world is getting education, because it is so difficult. Like, again, I said, to sift and sort through all the information out there in the world. So I'm bringing you wellness out of the box, things you may not get other places. So we have Dr. Alexander Thermos. So I think your finger may be over your camera, Dr. Thermos, because you're on with me. Let me see if I can hear you. You just popped on, but wherever your camera is we just don't see a clear picture. So see if you can potentially either adjust your camera or get it set up so we have you. I hear you. I hear some background. Let me see again if I can. I think you're there. Are you there, Dr. Thermos? I'm going to have you just say something with us. Hello, everybody. Dr. Thermos, are you there? This is so weird because I've brought you on. Ah, there you are. Excellent. Dr. Thermos, can you hear me? I don't know if it's potentially your internet connection. I see you very clearly. I just can't hear you for the moment, and you're a little bit paused. So you guys, I'm going to make sure he can find the perfect spot for him that he can come on and we can hear him clearly, because you are not going to want to miss the education of this gentleman, oxygen, and the therapy that is incredible. So I think he just had a connection issue, so I'm going to try to bring him back on for all of us. He's probably just finding a better spot that connects better for him. But let me tell you a little bit about my story with hyperbaric oxygen, if that's okay with everybody, because I too had to learn about what is it. And what I was doing is I wanted to optimize the health for my daughter. So my daughter, back in September, she had ACL surgery. She repaired her ACL, her medial meniscus, and her lateral meniscus. So knowing that, I really wanted to set her up for success in her journey before surgery, as well as after surgery, to make sure that her healing was optimal. So that's exactly what we did, and I put her in hyperbaric. And let me tell you, I did a variety of things. So just to let you know, and I'm going to be sorry, you guys, I'm adding him another way. I did a variety of things, but hyperbaric was one of them. And I truly believe that if we can all, again, use a multi-disciplinary approach when we're looking at how to heal and repair from whatever that is, then our success is absolutely going to be better overall. It is never just one thing, right? It's never just one thing. So Dr. Thermos, there may be either on your screen, you may have another invitation. You can also go in Facebook on your notifications and click there, because I try to re-invite you again. I'm doing it two ways. One of them, because I already did that way, it's saying I can't bring you on camera, but I think it just might be your connection. So let's see. And thanks, everybody. I mean, there's so many of you guys on, Jay and Lauren and Marlo and Brenda, and oh my gosh. So hey, hold tight, because this is just fabulous information that you really don't want to miss. So let's just see if we can bring Dr. Thermos on here, you guys. Gosh, Sarah and David, so many people keep joining. I really, really appreciate Kim and Beth. Wow. So Dr. Thermos, if you're there, and maybe he is disappeared on me, and that's why it said I can't bring him on camera. We shall see, you guys. But he may have had to jump off and jump back on. Obviously, we saw him. I think it was just his connection. So let me give it just a minute and see if his connection gets better, and we can bring him back on again. So for my daughter, a week before, and I'm going to let Dr. Thermos tell us like what he would ultimately recommend, but we put her in oxygen, hyperbaric oxygen, for 4 or 5 days consistently before surgery and after, to help with wound healing. And sometimes we see healing only on the outside, but what I know is so much has to happen on the inside. So I wanted to give her the optimal chance of healing. And I do have to say that we just went to her 9-month checkup with her orthopedic surgeon, and he's like, wow, she looks great. All of her testing, we did return to sport testing. That is amazing. I'm gonna have a wellness out of the box on return to sport testing. For those of you that have kids and trying to go back to sport after injury, it's pretty phenomenal. But she's doing great. And I know with our patients for stroke and traumatic brain injury, you know, there are actually some countries that have hyperbaric in the hospital setting, and after people have either a surgery or an injury like a stroke or traumatic brain injury, then they're actually right away putting them in hyperbaric oxygen chamber. Isn't that amazing? So sometimes I do feel like we're a hair behind the 8 ball here. But you know, so we just have to seek some of it out ourselves. So you guys, Dr. Thermos is telling us that he cannot connect. So I'm on another phone here. Give me just a minute to see. Let me ask him a quick question, everybody. Thanks again. Just hold tight a moment. Usually this all goes so smoothly. So thanks for holding on, you guys. I don't know if this is him coming back on or not. He's saying he's here, he's here. You guys, let me get him back on. So I'm going to see if I can uninvite. So I recently invited you again. Let's just see. I'm just trying to uninvite him. So, Dr. Thermos, if you see at the bottom of your screen, there's a little picture of like two people, a person and then a little box with another person. You can invite yourself. I did send the request to you. So if it's not popping up again, because I see that you're there, that's awesome. I just need to get you. I'm like, how do I get him back on? You guys, stay with us. I promise, stay with us. But that little box of two different people, you can click it and ask to be added to come on. Pretty cool. Let me just see if I have any other. Nope, don't want to do that. Okay, you guys. All right, we're trying this again. Those of you that have been holding tight with us, dun dun dun, he's going to be coming on. So if our connection's good, he should be showing up for us any moment here. And let's see if we can hear Dr. Thermos now.
Can you hear me now?
I can hear you. Your picture is yes, you're all good. You're a teeny bit grainy in your picture, but we can hear you. So that's what matters. How are you?
Sorry about all that. I'm not technically savvy when it comes to this.
Oh my gosh, no problem at all. And just wherever you have the best connection in your house or your office or wherever you're at, because you're still a little bit glitchy in the background.
Let me try moving to another location here.
So you guys, he's coming on even better. So let me give you, I've already been talking about Dr. Thermos, but let me give you some really, really good juicy stuff about him and his background, because it's phenomenal. And I already know it, but when I read it, it still blows me away. So a little bit about him is actually, his dad was a Greek immigrant and his mom is a first-generation Irish woman in Illinois. For him as a youngster, he actually played hockey at a very high level into college. And he was a goalie. And actually at that point, he had a very serious eye injury. And that kind of led his path into medicine and biology and chemistry and math and things like that. I think all of us in these, high school, college ages, it's like what lends us down the road to where we're at. For me, definitely, I had a lot of injuries in sports and it led me into physical therapy. But he went on to become a chiropractor, attending Palmer College of Chiropractic, and he graduated with honors. And from there, he truly went on this holistic journey for him. Like myself, I went back to school to business. Well, he also felt the urge to go back to school. And he actually first became a medical missionary. He sold his actually chiropractic practice. And then he went back to school and he actually graduated from Oklahoma State University College of Osteopathic Medicine and Surgery. And there he really learned to blend his osteopathic manipulative techniques with chiropractic. He went on and on more. Oh my gosh. He even went on to the School of Aerospace Medicine and was the chief resident in his final year. And it was there truly, right, Dr. Thermos, that you got your first introduction to hyperbaric and started learning that this is such an avenue for patients and for wellness. So maybe you can first tell us kind of about, how you found hyperbaric and your journey with it. And then we'll kind of back up to 101. What even is it? So people can kind of get a basic.
Sure. So yes, when I was in the Air Force is when I fell in love with hyperbaric oxygen therapy as a treatment, because it's so benign as far as a treatment goes. What is more natural than supplying the body with more oxygen? And it's got so many different applications. Any type situation where a patient's tissue is devoid of adequate oxygen supply, the tissue is not going to function properly. So anything you can do to restore oxygen to that tissue, you're going to restore to the vital capacity of that tissue to be able to respond and to heal. And so I saw so many applications, and the more involved that I got with hyperbaric when I was in the Air Force, the more I fell in love with it. And I couldn't wait to get out into private practice because there were so many applications, because the Air Force had their restrictions on who they would treat with their hyperbaric chamber. They dominantly did a lot of things like burn injuries and wounds and things like that. But it's got a lot of applications for stroke patients, Parkinson's patients, athletic injuries as far as responding to treatment. Most of the time when you've got a chronic injury, it's usually devoid of adequate circulation. There's a lot of scar tissue and there's compromised circulation. And so when you compromise the circulation, the tissue doesn't have the ability to heal very well because you can't deliver the oxygen to the tissue, you can't deliver the nutrients to the tissue so that the tissues can respond and heal properly. And so just by supplying the oxygen to the tissue, you can wake up the tissue that's idling or functioning just marginally at that point in time. And then if you can stimulate new blood vessel formation being sent to the tissue, then you can supply more nutrients to that tissue. So it's a great therapy and so gentle. Most of the time patients are sleeping or go to sleep when they're receiving hyperbaric therapy, which is even a better representation as far as the treatment, how gentle it is.
So tell us, if anyone's like, what even is that? I know that there's a variety of different chambers and basically you lay in it for a period of time. Like if somebody knows nothing about it, just tell them what it looks like, what somebody would do, and kind of the basics 101 on what's happening with their cells.
Sure. So hyperbaric oxygen is delivering oxygen at a prescribed amount under pressure. So what happens is when you're under pressure, you can force more oxygen into the tissues. When we're breathing the oxygen that's in the air, all we can saturate are our red cells and their ability to carry oxygen via hemoglobin. When you're using hyperbaric oxygen, you're actually saturating the plasma and the liquids with the oxygen. So you can deliver up to 20 times more oxygen to those tissues, even if the circulation is compromised. So sometimes the little red cells cannot get through the little capillary beds because of all the scar tissue that's taking place. And so what happens is that by saturating the liquid in the tissues, liquid in the vessels, you can get that liquid into places where you can't get any cells, which can then spark the healing process to start moving forward. So the patient is breathing oxygen in a chamber under pressure, and we vary the pressure according to what we're trying to do. For example, the higher pressures we use to suppress more inflammation, also to choke out infectious type processes along the way. And the more gentle pressures are the ones that the nervous system responds to. So it's very much a condition dependent prescription as far as to how it's delivered. And that's, so the patient's in the chamber for approximately 60 to 90 minutes at a period of time, and that completes one treatment. Like I said, most of the time the patients fall asleep when they're in the chamber, which is really nice. They can see outside the chamber. The chamber that I have is a heavy metal chamber. It weighs 2,100 pounds. There are the soft chambers that a lot of people use out there. For medical purposes, generally I like to use the hard shell chamber because you can deliver higher pressures to the patient in order to force more oxygen in the tissues.
And when you say a chamber, like for somebody that even knows nothing about it, because I know there's actually anything from a room to something like lying down that you look like you're enclosed. Now they have some that you're kind of more sitting up, and you could actually even watch television. Is that correct?
Correct. Yeah. Oftentimes, if the chamber is pressurized with oxygen, you can't bring any type of video type device inside the chamber. But if the chamber is pressurized with room air and they're breathing the oxygen, patients bring their phones and stream videos, etc., so they can watch television, watch programs, watch movies, search the internet, speak with their friends, do a little bit of research. So it's a nice opportunity for them.
Hopefully they're just resting. They're using this as some downtime to reset their systems and just be able to take it in, right? We're always too crazy in this busy world. So hopefully they're just enjoying this. So let's just say somebody comes in. Obviously, depending on their different diagnosis, it might mean like how many treatments they would have. But maybe first you
Correct.
can go over like what are some of the common things that you see? I know hyperbaric can be beneficial for a vast number of diagnoses, but kind of tell us what would be a big generalized that people should kind of keep their eyes and ears open, like, oh, my friend has this. Oh, my sister-in-law is about to have this surgery. Like, so people have an idea of who might come see you for that.
So, for example, if somebody is going into surgery having a lot of cosmetic procedures, we pre-treat patients for before the surgery. What that does, it stimulates the vascular bed and really fluffs up the tissue, so to speak, so it's healthier when they go to do their surgical procedures, and so there's a better chance of it healing more quickly. Oftentimes after a surgery, we see the patients come in, especially after the cosmetic procedures, because what the pressure in the chamber does is it reduces the swelling in the tissue. When it reduces the swelling in the tissue, you improve the vascular supply to that tissue, and then you can generate new blood vessels. That's one of the great things about hyperbaric, is that it stimulates new blood vessel formation, so which is critical to healing, especially after a surgery of some sort. Um, Hyperbaric is used for stroke patients. One of the big issues for stroke patients is they've got a compromised circulatory supply going up to the brain. So whether it be an occlusive stroke as a result of a clot of some sort, or whether it be a bleed of some sort where they actually have a blood vessel rupture, there's compromised circulation of the tissue. So there's less chance for that tissue to ever respond to any type of therapy if they don't have a proper blood supply. So with
Up, you guys, we might just have a glitch in his connection, so hold tight.
yeah, there you go.
Yes, keep going. Great.
With the hyperbaric oxygen, you actually stimulate new blood vessel formation in the tissue, so you can bypass whatever that is blocking the blood flow to the tissue, whether it be a clot or whether it be a disruption and actually torn up blood vessels in the area. And so you can stimulate new capillaries to be generated. It's called angiogenesis. And so angiogenesis has applications in a lot of different type situations. Chronic injuries. Oftentimes the chronic injuries, like I'd spoken of before, have a compromised circulation. So if you can improve the blood supply to that tissue, then it's going to respond to healing.
Wow. I mean, are you guys understanding the vast implications of all of this? I'm going to, for me, I know that some things are an acute injury. So you may see obviously improvements faster. Other things are chronic injuries. And so you may just over time be optimizing yourself over time for, your best option of healing, like with chronic neurological diseases. But even things like autoimmune diseases, let me just read you a litany, and I'm going to put these in the notes down below, everybody, so that you can kind of refer back to them. But whether it's wound healing, chronic neurologic diseases like stroke, Parkinson's, ALS, dementia, cerebral palsy, head injuries, concussion, okay, all of those things, autoimmune diseases like rheumatoid, ulcerative colitis, lupus. Another big buzz going on right now, right, is stem cell therapy. And so in conjunction with people having stem cell therapy to optimize what those new stem cells are going to do for you, fibromyalgia, chronic fatigue, assist in wound healing for pre and post-surgical. That's what Dr. Thermos was talking about. And that's what I said we did for our daughter when she went in for her ACL, MCL, that huge big surgery. And then there's, cancer, post-rehab, inflammation, chronic. I mean, you guys, it goes on and on. So you yourself just need to know, am I going to add this to my regimen? Maybe you can talk a little bit about, how this could benefit cancer patients. Because sometimes I know people are very afraid of thinking certain modalities might make the cancer cells more healthy or susceptible. So how would hyperbaric benefit them?
So what you need to understand is a little bit about tumor biology. One of the main things that happens with cancer tumors is that dominantly they are um, tend to operate in a hypoxic type situation. So they do better at a lower oxygen tension. So when you saturate the tissue and blast it with large volumes of oxygen, well, that actually blunts the tumor's ability as far as its metabolism goes, which can be very effective because if you can pop the tumor with a large volume of oxygen, and then the patient, let's say, is going for their chemotherapy treatment right immediately after that. Well, the tumor's already been knocked over the head by altering the physiology that's taking place. and rendering it more oxygen dependent environment, where the tumor prefers to have an oxygen deficient type environment. So therefore you're gumming up their metabolism, so to speak. Now we take advantage of that in our office, because I also combine that with high dose intravenous vitamin C. So the combination of the two, with the intravenous vitamin C, what that does is that generates hydrogen peroxide radicals. So you can see if you really fill the tissue with lots of oxygen and then give the patient intravenous vitamin C, and they generate these hydrogen peroxide radicals, which then are toxic to the cancer cells. They actually cause apoptosis, the programmed cell death of the cancer cells. The healthy cells, however, have an enzyme called catalase, and so we're dominantly protected from any type of oxidative stress that takes place with that. So you can selectively go after and knock out cancer cells without creating any harm to the surrounding tissue. So in cancer patients, it can be used in a couple different ways: pre and post chemotherapy, pre and post radiation therapy, which has a lot of applications. In fact, even traditional medicine recognizes the use of hyperbaric oxygen for something called radionecrosis, osteoradionecrosis, where the radiation actually damages the bone, and the bone itself has a compromised circulatory supply, so you can reestablish the circulatory supply so the bone doesn't die. That happens a lot of time in head and neck surgeries, where the jaw gets destroyed because of radiation that's being done, and then a simple event like a dentist going to pull a tooth or work on a tooth, and then the jaw's been already compromised, and then the bone starts to decay and break down, and it turns out to be a real mess as far as the patient goes. And so simple prevention can help quite a bit. If the patient has had radiation therapy and they've developed the osteoradionecrosis, actually hyperbaric oxygen has been shown to help reverse that whole process too. So even if they've missed the boat, missed the opportunity to pre-treat prior to the dental procedure, you still can come in post haste and still make some positive changes and interrupt this whole process so that they can have a chance to heal.
Wow, it's really unbelievable. And again, you guys, all of these modalities aren't something that normally your doctor would say, okay, you have this, I want you to go in, I want you to do like infrared sauna, I want you to do acupuncture, I want you to do hyperbaric, I want you to do IV infusions, I want you, like, they're not going to tell you to do all this stuff. You have to seek it out for yourself. But the benefits of all of these things are powerful. And so ultimately, it's my job to educate everybody to say, you are your own CEO of your health. You need to be in charge of that. And so, gosh, Dr. Thermos, this is incredible information. I know historically, most people might say, oh, well, isn't it used for like chronic wound healing or, things that long ago it was originally established for? But today, the benefits for so many different diagnoses. And would you agree, maybe you can tell a little bit of why so many diagnoses benefit, is because it's truly helping at this getting to root cause cellular level. Is that right?
Exactly right. When you're getting to the tissue level, so any situation where there's a compromised circulation. Sorry, that got another glitch there on my phone. Anytime there's compromised oxygen delivery to the tissues, has an application as far as hyperbaric goes. So there are so many different disease processes. Medicare has their prescribed guidelines that they go by, and they have 14 conditions that they will approve hyperbaric oxygen therapy for, but it has more applications than that. One of the great things that we've seen over the years is, long before stem cell therapy was really understood and discovered, we knew that by treating patients with hyperbaric oxygen, some of the patients did really well and they bounced back more quickly. At the University of Pittsburgh in 2005 has found out that after 20 hours of hyperbaric therapy at 2 atmospheres of pressure, you actually stimulate the body to release their own stem cells 800% above the normal, circulating the tissues, just with hyperbaric therapy. So without even doing a stem cell treatment, you're basically doing a mini stem cell treatment for, let's say, a stroke patient receiving hyperbaric therapy when they're just sitting in the hyperbaric chamber, because we saw those patients respond. I've got a patient right now who's 72 years old, and we had talked about doing stem cell therapy with him to help him recover from a stroke. He was 7 years out from a stroke and had been in a wheelchair for 7 years now. So what I had done is I we talked to him and had him come in. He had to quit smoking, so I didn't treat him for 3 months until he had the smoking underhand and got rid of that. And then he came to the office. We started doing hyperbaric therapy. Well, he's now, believe it or not, he's now able to walk. After 7 years in the hyperbaric chamber, he's able to walk. We combined his hyperbaric therapy with a really strong physical therapy program. And we don't do the therapy at our office. I just talk to the physical therapist about it. But Jim's now able to get up from his chair by himself and walk with a quad cane 150 yards one direction and 150 yards back. Well, think about the quality of life changes that has for him.
That's right.
He's now able to get up out of his chair himself. He can get himself into the bathroom instead of having to call for his wife to help him out of the wheelchair and transfer onto a toilet. So, I mean, that's just a small view of all the things that how his life is changing here right now. And so, doing the hyperbaric therapy alone, he's not needed to do any stem cell therapy. He's responded because of those stem cells that his body's produced endogenously and released from his bone marrow.
Oh my gosh, you guys, is that not, I mean, I'm sure none of you were aware of this. And obviously stem cells is kind of the hot buzz out there right now. So could you imagine you do hyperbaric and you stimulate your own body to have more stem cells produced? That is phenomenal. So Dr. Thermos, what would it look like? Like, do people come in for 1 session, 6 sessions, 20 sessions? Like, I know it definitely depends on diagnosis and what's each and every patient is very different, but in general, what would that look like for somebody?
So depending upon the condition and what you're trying to accomplish, it's very much condition dependent as far as the amount of pressure that they're being delivered, what the oxygen supply is, as well as the number of times that they're treated. So generally, it's thought of in the amount of hours, the number of hours that a patient is being treated. Now, there's a Dr. Paul Harch down out of the who practices down in Louisiana, and is teaches down there at the medical school. Anyway, he's considered one of the hyperbaric authorities here in the world, one of the leading hyperbaric authorities in the world. And so he has set out some guidelines. And generally, neurologic injuries require anywhere between 20 to 40 hours of hyperbaric therapy. So it's repeated sessions that they're getting. They're not going to sit for 20 hours in a chamber. In fact, that would be contraindicated to do something like that anyway.
Yes.
But 20 to 40 hours is generally what's considered necessary for a chronic neurologic condition versus a wound. Somebody after a surgery, oftentimes they can be treated for 3 to 5 sessions, the wound to heal after surgery, and that's all that they'll need. So it's very much condition dependent as far as to how they're treated and the number of times they're treated and the sequencing. So like I mentioned earlier, you want to sequence things for, let's say, the IV therapy that I give with the intravenous vitamin C. Right after they come out of the hyperbaric chamber, there's about a 3.5 hour window where the tissues are super saturated with oxygen. So that's the optimal time for them to receive the IV, the intravenous vitamin C therapy, to get a 1 + 1 = 5 instead of 1 + 1 = 2. So
right.
those patients would get a hyperbaric therapy first, followed immediately by the intravenous vitamin C, and not do it on 2 separate days, because you're going to get a better outcome doing things that way.
Oh my gosh, how fabulous. So let me just kind of close with a couple things. One, when people are looking to go find hyperbaric for themselves, what sort of places should they look for? Because I know I've even heard of home units now, things like that. But if people really want to maximize, when they're, obviously, they can come find you. And at the end, we'll put in the show notes, you guys, his office and where he's located and how to contact Dr. Thermos. But what kind of questions should people ask to make sure that they're going to, say, a reputable place?
Well, you want to know about the person who's running the hyperbaric chamber, their training, to make sure that the person who's doing the hyperbaric therapy has had some formal training in it and not just purchased a unit off of eBay along the way. I mean, that does exist out there.
Yeah.
The soft-sided chambers generally only generate up to 1.3 atmospheres of pressure. And so oftentimes for wound care, you need to generate at least 2 atmospheres of pressure. So wound care type thing for complicated wounds, a soft-sided home chamber is definitely not going to be adequate in order to supply that along the way. What they want to know is, does the office that's supplying the hyperbaric therapy, do they use a hard shell chamber, which is, in my mind, preferred, because that's where you're able to generate the variety of the pressures, versus the soft-sided chamber, which only, like I say, it can generate up to 1.3 atmospheres of pressure on the way, and that's generally not adequate for a lot of things. I mean, for home treatments and things like that, and parents treating their children with autism, if they're under the guidance of a physician doing something like that, that can be helpful. But they want to know how the chamber is pressurized. Is it pressurized with oxygen? Is it pressurized with room air? Are they breathing 100% oxygen? Who the operator is? Are they going to be in contact with the physician or technician the entire time, so that they can reach out to them? Because when you're sitting behind that closed door, you want to know that somebody's going to respond to you if you need their assistance along the way.
Exactly. Wow, you guys. So that's pretty, I mean, it's a vast number of diagnosis and even I would say for overall wellness, um, looking at all of us optimizing ourselves, we never know what dis-ease is brewing inside each and every one of us. So does anybody ever use the hyperbaric for actually prevention?
Sure, it's got a lot of one of the number one things that impairs regeneration of tissue in somebody who's trying to, let's say, change their lifestyle and get healthy again is compromised circulation. So if you compromise circulation along the way, the tissue is not going to have as great a chance to respond. So yes, for rehabbing tissue, for just trying to turn your health around, you can't go wrong by getting more oxygen to the tissues by any stretch, and that oftentimes is a rate limiting step in somebody's ability to heal.
Wow. So you guys, so many things. And again, there's a lot out there that is so safe, right? So it's just like high benefit, low risk. It's a win-win. So Dr. Thermos, maybe you can just share with them, what other things do you do in your office? Because I know you've shared a few things. Hyperbaric is only one, but tell them like a little bit about what your clinic is, what other services you provide for those of the listeners out there located in Orange County.
Sure. So ours is more of a holistic oriented clinic. I've always had that bend based on my background and my training. We do a lot of intravenous nutritional therapies. Of course, the hyperbaric, like we've spoken of today. I personally do acupuncture with my patients in those situations where I think it's warranted along the way. I do a lot of soft tissue and osseous manipulation, having been trained as an osteopath and a chiropractor. So I do a lot of manipulation of joints and tissues to help them respond. I do a lot of bioidentical hormone replacement. Oftentimes, when somebody's trying to heal up tissues, they may be deficient in some of the components which are necessary for anabolism, generating new tissue. And the main anabolic hormone for both men and women is testosterone. And so if a patient is deficient in testosterone, a wound is going to be delayed in healing if you don't have the driving force behind it hormonally to help generate new tissues. So we do a lot of bioidentical replacement hormone therapy just based on the patient's individual labs. All patients have their own labs done, and I send them out for laboratory studies through LabCorp, Quest, etc. And we just treat based on what the results are. See a lot of cancer patients through the office. More often than not, by the time somebody makes it to me, they're usually stage 4. If they would seek things out earlier, like a stage 2 or a stage 1, there's a lot less treatment involved and a lot less morbidity, mortality associated with their traditional therapy, the chemotherapy, radiation, and surgery. So oftentimes we're treating patients that have been given a terminal diagnosis, told there's nothing more that can be done, and of course we try and restructure their diet. There are some supplements that I have them take periodically, and then we embark upon a program to help try and restore their bodies and make their quality of life as good as it possibly can for whatever the days the Lord has left for them here on this earth. And if they happen to get a healing, I've got a lady right now that came from San Diego. She was told she was stage 4. She's been under treatment for approximately 2 months, stage 4 as far as breast cancer goes. And right now, all her tumor markers and everything have gone to essentially 0, just with natural therapies and with her diet. And she's just thrilled to death, needless to say, because she's got 2 twin boys that she's looking at raising that are both 11 years old. And she wants to be there to be with them when they graduate from high school. So she is just over the moon as far as how well she's done. Another lady that I've got in her office right now was diagnosed with a stage 4 ovarian cancer. She's 24 years old and found out that she had had the ovarian cancer a month after she was married, unfortunately. So she's been
Oh
through an awful
gosh.
lot. And but right now, all indications are all her tumor markers have gone essentially down to normal ranges, and she's feeling good, and she's starting to put back on weight. She is doing a combination of the natural therapy and chemotherapy, so it's not just she's not doing just non-traditional therapy. But the big thing for her is she's got a great quality of life, and she's winning. She's winning the battle against the cancer. So chronic disease type stuff, autoimmune type disease, there's a wide variety of things that we treat. I do a lot of PRP too. I don't know if you've heard of PRP at all, but that's
I
usually
have. I don't think most
platelet-rich
people know what
plasma.
that is. Yes.
Yeah, so what we do is we take the patient's platelets, we draw their blood, we separate the blood and separate out the platelets, and we take those platelets from the blood and we inject that into the joint site or around the ligament. And what that does is these platelets act like little Ziploc bags full of growth factors. And by placing the growth factors at the site, you're basically placing fertilizer at the area where you're trying to generate the healing to take place. And so 2 to 3 treatments are generally what's needed if somebody's going to respond to something like that. And I can tell you, platelet-rich plasma is a great way to go, especially for if it's not severely degenerated, but more of an acute type injury that just is not responding as quickly to treatment as needed to.
Wow, your office is full of so many options for people in healing. So, Dr. Thermos, how can people reach you? What's your clinic name and what's like your website, or how would people best access you?
Sure. So we're in Laguna Hills, California. Uh, our website is www.lifesourcewellnesscare, all one word, .com. The office phone is 949-916-0089. And I'm blessed to be working in the office with my wife. My wife is the one who answers the phone for us, and so we get to work together every day. So they can call Sandra and speak with her, and we can set up an appointment and discuss whatever is going on with the patient and try and figure out if there's something we can do, a different strategy to help them recover from whatever it is that they're consulting for.
Oh my gosh. Well, today was absolutely amazing. Again, you guys just want to educate, put it out there, what all the options are. And so understanding each and every one from a practitioner is so vitally important. So if something today resonated with you, if you yourself, if you have a friend, a family member, share this with somebody that might need this help, because you never know whose help you truly have in your hands that you could touch, and that after all the stories Dr. Thermos shared with us, they too may want to take advantage of some of the options that he has in his office. So, Dr. Thermos, any other closing words you have for people?
No, just thank you, Kelly, for having me on to speak with you about this. Just trying to get the word out about options that patients have along the way that oftentimes they don't know. As you eloquently stated in the beginning, oftentimes their regular physicians don't know about these options, and their patients can have to do some digging and find out some things on their own. And whereas I'm not a big supporter of Google University to find out everything that
Right.
you need to know about your illness, but it can provide you with some ideas as far as options, and you need to do your own investigation. But we'd be glad to help anybody along the way that needs our help.
Oh, 100%. Well, you guys, thanks so much. We are signing off for today. If anybody wants further information, again, in the show notes, I'll put down below information of how to reach Dr. Alexander Thermos and his office, as well as all the, not all, but some of the diagnosis that can benefit from being treated by hyperbaric and more. And if you guys have any further questions, just reach out and we're happy to help. So with that, we're going to sign off for today. Thanks, everybody. Thank you, Dr. Thermos.
Thank you, Kelly. God bless you. Bye-bye.
You too. Bye-bye.